Pneumonia is a common respiratory infection that affects the lungs. It is caused by a variety of different microorganisms, including bacteria, viruses, and fungi. Pneumonia can range in severity from mild to severe, and can be life-threatening in some cases. The symptoms of pneumonia can vary depending on the cause of the infection, but typically include coughing, chest pain, fever, and difficulty breathing. Other symptoms may include fatigue, weakness, and a general feeling of being unwell. Pneumonia can affect people of all ages, but is most common in young children, older adults, and people with weakened immune systems. Risk factors for pneumonia include smoking, chronic lung disease, and certain medical conditions such as diabetes and heart disease. Diagnosis of pneumonia typically involves a physical exam, chest X-ray, and laboratory tests to identify the specific microorganism causing the infection. Treatment may include antibiotics, antiviral medications, and supportive care such as oxygen therapy and fluids. Prevention of pneumonia includes measures such as getting vaccinated against certain types of bacteria and viruses, practicing good hygiene such as washing hands regularly, and avoiding close contact with people who are sick. In conclusion, pneumonia is a common respiratory infection that can be caused by a variety of microorganisms. It can range in severity from mild to life-threatening and can affect people of all ages. Diagnosis and treatment typically involve a combination of physical exams, laboratory tests, and supportive care. Prevention measures include vaccination, good hygiene, and avoiding close contact with sick individuals. Pneumonia is a respiratory infection that affects the lungs. It can be caused by a variety of microorganisms, including bacteria, viruses, and fungi. In most cases, pneumonia is caused by bacteria, with Streptococcus pneumoniae being the most common culprit. Other bacteria that can cause pneumonia include Haemophilus influenzae, Legionella pneumophila, and Mycoplasma pneumoniae. Viral pneumonia is also a common cause of the illness, especially in children and older adults. The most common viruses that cause pneumonia include influenza, respiratory syncytial virus, RSV, and adenovirus. Fungal pneumonia is less common and usually affects people with weakened immune systems, such as those with HIV, AIDS, or undergoing chemotherapy. Pneumonia can also be classified based on where it was acquired. Community-acquired pneumonia, CAP, is the most common type and is acquired outside of a hospital or healthcare facility. Hospital-acquired pneumonia, HAP, occurs in patients who are hospitalized for other reasons and develop pneumonia while in the hospital. Ventilator-associated pneumonia, VAP, is a type of HAP that occurs in patients who are on a ventilator. Risk factors for developing pneumonia include age. Young children and older adults are more susceptible. Smoking, chronic lung disease, weakened immune system, recent respiratory infection, and exposure to certain chemicals or pollutants. Pneumonia is spread through respiratory droplets, which are released when an infected person coughs or sneezes. The droplets can be inhaled by others, leading to infection. It can also be spread by touching a surface contaminated with a bacteria or virus and then touching one's mouth or nose. Symptoms of pneumonia include cough, fever, chills, shortness of breath, chest pain, fatigue, and confusion, especially in older adults. Diagnosis is usually made through a physical exam, chest X-ray, and blood tests. Treatment depends on the cause of the pneumonia and may include antibiotics, antiviral medication, or antifungal medication. Prevention of pneumonia includes getting vaccinated against the flu and pneumococcal bacteria, washing hands frequently, avoiding close contact with sick people, and quitting smoking. Sure, here's a script about 5 good foods for pneumonia. 1. Garlic. Garlic is known for its antibacterial and antiviral properties, which can help fight off the infection causing pneumonia. It also contains a compound called allicin, which has been shown to have immune-boosting effects. 2. Leafy greens. Leafy greens like spinach, kale, and collard greens are rich in vitamins and minerals that are essential for a strong immune system. They also contain antioxidants that can help reduce inflammation in the lungs. 3. Ginger. Ginger has been used for centuries as a natural remedy for respiratory infections. It has anti-inflammatory properties that can help reduce inflammation in the lungs and improve breathing. 4. Turmeric. Turmeric contains a compound called curcumin, which has been shown to have anti-inflammatory and antioxidant effects. It can help reduce inflammation in the lungs and improve overall lung function. 5. Citrus fruits. Citrus fruits like oranges, lemons, and grapefruits are rich in vitamin C, which is essential for a strong immune system. Vitamin C has also been shown to have anti-inflammatory effects, which can help reduce inflammation in the lungs. Overall, these 5 foods can be beneficial for those with pneumonia due to their immune-boosting, anti-inflammatory, and antioxidant properties. 1. Fried foods. Fried foods are high in trans fats, which can increase inflammation in the body and weaken the immune system. Instead, opt for grilled or baked foods which are healthier and less likely to cause inflammation. 2. Processed meats. Processed meats like bacon, sausages, and deli meats contain high levels of sodium and preservatives, which can increase the risk of pneumonia. Instead, choose fresh, lean meats like chicken or turkey. 3. Sugary drinks. Sugary drinks like soda and fruit juice can weaken the immune system and increase inflammation in the body. Instead, drink plenty of water and herbal teas to stay hydrated and boost your immune system. 4. Dairy products. Dairy products like milk, cheese, and butter can increase mucus production in the body, making it harder to breathe and increasing the risk of pneumonia. Instead, try plant-based alternatives like almond milk or vegan cheese. 5. Alcohol. Alcohol can weaken the immune system and increase inflammation in the body, making it harder to fight off infections like pneumonia. Instead, limit your alcohol intake or avoid it altogether to stay healthy and strong. Pneumonia is a respiratory infection that can be caused by bacteria, viruses, or fungi. It is a serious illness that can lead to hospitalization and even death, especially in young children, older adults, and people with weakened immune systems. However, there are several steps you can take to prevent getting pneumonia. Firstly, Practicing good hygiene is essential to prevent the spread of germs that can cause pneumonia. This includes washing your hands frequently with soap and water, especially after being in public places or around sick people. You should also cover your mouth and nose when coughing or sneezing, and avoid touching your face with your hands. Secondly, maintaining a healthy lifestyle can help boost your immune system and reduce your risk of getting pneumonia. This includes eating a balanced diet that is rich in fruits, vegetables, and whole grains, getting regular exercise, and getting enough sleep each night. Thirdly, getting vaccinated is one of the most effective ways to prevent pneumonia. There are two types of vaccines available, the pneumococcal vaccine and the flu vaccine. The pneumococcal vaccine protects against the most common cause of bacterial pneumonia, while the flu vaccine can help prevent viral pneumonia. Lastly, avoiding smoking and secondhand smoke is crucial in preventing pneumonia. Smoking damages the lungs and weakens the immune system, making it easier for germs to cause infections. If you are a smoker, quitting smoking can greatly reduce your risk of developing pneumonia. In conclusion, taking these steps to prevent pneumonia can help protect your health and reduce your risk of getting sick. By practicing good hygiene, maintaining a healthy lifestyle, getting vaccinated, and avoiding smoking, you can help keep your lungs healthy and strong. Pneumonia is a respiratory infection that affects the lungs and can cause severe illness in individuals. There are several ways to cure pneumonia, including 1. Antibiotics. Antibiotics are commonly prescribed to treat bacterial pneumonia. The type of antibiotic prescribed will depend on the severity of the infection and the patient's medical history. 2. Antiviral medication. Antiviral medication may be prescribed to treat viral pneumonia. This type of medication can help reduce the severity of symptoms and shorten the duration of the illness. 3. Oxygen therapy. Oxygen therapy may be necessary for patients with severe pneumonia who are having difficulty breathing. This treatment involves providing supplemental oxygen to the patient to help them breathe more easily. 4. Rest and hydration. Rest and hydration are essential for patients with pneumonia. It is important to get plenty of rest and drink fluids to help the body fight off the infection. 5. Breathing exercises. Breathing exercises can help improve lung function and reduce the risk of complications from pneumonia. These exercises may include deep breathing, coughing, and using a spirometer to measure lung function. 6. Vaccination. Vaccination is an effective way to prevent pneumonia. The pneumococcal vaccine can protect against the most common bacterial cause of pneumonia, while the flu vaccine can help prevent viral pneumonia. 7. Hospitalization. In severe cases of pneumonia, hospitalization may be necessary. This allows for close monitoring of the patient's condition and the administration of intravenous antibiotics or other treatments. In conclusion, there are several ways to cure pneumonia, including antibiotics, antiviral medication, oxygen therapy, rest and hydration, breathing exercises, vaccination, and hospitalization. The type of treatment prescribed will depend on the severity of the infection and the patient's medical history. It is important to seek medical attention if you suspect you have pneumonia to receive the appropriate treatment and prevent complications. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.